Welcome, and thank you for joining us for the RSNA 2024 Radiology Reimagined demonstration. Hi, I'm Alicia Dami from Stanford University Medicine, and I'll be your guide for this introduction. Artificial intelligence and adjacent emerging technologies continue to make strides in radiology. AI can transform healthcare and address both computer vision and non-diagnostic tasks. RSNA has organized this demonstration under the direction of the Radiology Informatics Council to highlight ways that AI is already impacting the care we provide, to show how AI and other emerging relevant technologies will change the way radiologists work, and to explore what is needed to deploy and maintain AI effectively. As part of this demonstration, we again invited vendors of imaging, reporting, and AI systems to showcase tools that are currently in use or coming soon. Vendors were assigned to specific roles based on their capabilities and organized into 3 functional teams around fictional clinical scenarios. In each scenario, from the perspective of a radiologist, we go through several tasks aided by AI and supported by evidence-based care and diagnostic radiology. These tasks span the radiology workflow, from pre-acquisition to post-processing to reporting. Such tasks include faster protocoling and image enhancement at the pre-acquisition stage, the use of an AI orchestrator to integrate all AI tools, prioritization of work lists, as well as overlays on images for segmentation or completing measurements. Let's take a look at sample ways AI can improve the radiology workflow. Prior to image acquisition, AI facilitates protocoling, making it faster and more consistent. At image acquisition, AI aids in the reconstruction of MR images, an intense area of research. Algorithms aid in enhancing MR image resolution, reducing scan times. An essential component for successful AI implementation is the AI orchestrator, or traffic cop. The orchestrator streamlines integration of AI tools, making sure the correct imaging exam is presented to the right AI model. The AI orchestrator returns the results to the correct system. Another way AI can enhance radiology workflow is automating the prioritization of reading work lists. Interpretation worklist managers consolidate input from variables including workload and radiologist availability to allow timely review of results for urgent findings. Finally, the AI results are presented to the radiologist to review, edit, and accept or reject. AI results can include overlays such as segmentations or measurements on an image. AI results, such as ARIA findings or PI-RADS assessment categories, can also be sent directly to the report. The patient scenarios in this demonstration were designed to showcase actions for both acute and non-emergent findings. These cases demonstrate how using AI can improve efficiency of evidence-based care throughout the radiology workflow. You are about to participate in one of 3 scenarios: OB ultrasound and PE workup, prostate MRI with radiology pathology correlation, and ED trauma to ARIA workup. As you progress through our clinical stories, please excuse inconsistencies as we assembled imaging from several real patients. Additionally, some of the products that you see are either prototypes or still under development. Assembling the demonstration underscored the crucial role of interoperability standards and frameworks such as DICOM, IHE, and HL7 FHIR for the effective deployment of AI in an integrated workflow. These standards facilitate exchange of image annotations, findings, measurements, and assessment categories. Semantic standards, such as RSNA's RADLEX, Common Data Element Modules, and RAD report templates help ensure clarity and interoperability. We are about to begin with one of our 3 clinical scenarios. Please remain seated for the live demonstration, and welcome to Radiology Reimagined.
All right, welcome everyone. My name is Neil Bhatia. I'm a third-year radiology resident at Brigham, and I will be walking you through the first clinical scenario. So, we're going to be walking through the clinical scenario of a patient who comes to the ED for a stroke-like symptoms. For the purposes of the demo, like the video mentioned, the images may not perfectly line up, but because they're actually taken from multiple different patients. This demonstration should take about 10 minutes, but I encourage you all to talk to our representatives today from each of the different vendors. They are technical representatives and not sales representatives, so they have really valuable insight in how the products are developed and implemented. Okay, so let's get started. So, on the right screen here, all of you should recognize this as passed. This demo will show results embedded within this system with which you are used to working every day. In our case, we're going to be using Visage 7 Enterprise Imaging Platform. So, our patient John presents to the ED after experiencing a fall. He is noted to have stroke-like symptoms as well as altered mental status on presentation as well. Once the patient is stabilized, a brain MRI is ordered. The radiologist protocoling the study recognizes that prior studies were performed at a memory and aging clinic to work up this patient's history of Alzheimer's. The radiologist sees that the patient was actually prescribed lecanemab, which is an anti-amyloid beta antibody, which is prescribed for patients who have Alzheimer's disease. The MRI, in our case, is then protocoled per institutional ARIA protocols, including appropriate sequences for comparison with his prior MRI scan. Now, coordinating John's care requires tight integrations between multiple different systems, such as PACS, EMR, reporting, as well as the different AI algorithms that we're going to show today. Now, many of you know that these systems speak different languages, such as DICOM, HL7, and FHIR, but you might not know that an essential role, such as the product Qvera Interface Engine, plays behind the scenes to enable such tight integrations, which is a key component of interoperability. Qvera Interface Engine acts as a translator between all of these different standards between systems to ensure that systems can communicate effectively and makes everything work just. So, returning back to our patient. The MRI is acquired, and the images are then sent to Laurel Bridge Compass, which acts as a central controller or traffic cop that also ensures that studies are sent to the appropriate AI models for analysis. Laurel Bridge Compass then sends the images to Swift MR to obtain augmented MR images, which you can see on the right screen here. Swift MR sequences are acquired with less time per study, and in some cases up to less than 50% time. Here we can see an example case from a different patient. The left side of the screen shows an image acquired without Swift MR, compared to the right side of the screen, which is actually required with the Swift MR. Now, going back to our case, the MR images are then sent to the Visage PACS for storage and to the icometrix, icobrain, ARIA, and Siemens AI-RAD companion algorithms. Now, before we take a look at the AI results, all of you should recognize that our imaging work list is actually seen within Epic, and that is helping us drive our imaging work list. That is just one way of doing things. Another way would be to use your PACS to drive your imaging workflow as well. So, let's turn our attention to the icometrix, icobrain, ARIA, which is an AI assistive tool for automated detection and quantification of ARIA. The AI results in our case are presented in the Fovea AI cockpit viewer, which should come up shortly. And what we're going to see within the viewer is findings concerning for both ARIA-E and ARIA-H, noted with segmentation overlays on the original MRI images, which you can see on the right on the screen. So as I wait for the screen to come up, we'll go back to what our AI results show, which you can see now. The icometrix icobrain ARIA AI tool helps us to detect and quantify ARIA in brain MRIs using T2 and FLAIR sequences. The algorithm quantifies edema, gyral swelling, as well as sulcal effusion in the case of ARIA-E, and in the case of ARIA-H, it helps highlight microhemorrhages as well as superficial siderosis. For each ARIA marker, the icobrain ARIA calculates a severity score based on the FDA safety label, and it includes it within the report, highlighting the key metrics used to develop that score. Icobrain ARIA even helps detect subtle changes which are sometimes missed by the radiologist. Now, in our case, the AI result shows that there is increased edema at the left greater than right frontal, parietal, and occipital lobes, compared to the brain MRI from January. We also see increased foci of microhemorrhages and superficial siderosis at the frontal and parietal lobes. Just as a reminder, the AI results are also available to review within Visage 7 PACS for immediate review as well as future comparison on follow-up studies. So let's turn our attention to the second AI solution that we mentioned earlier. If you recall, the images were acquired and sent to the Siemens AI-RAD companion tool by the Laurel Bridge AI orchestrator. The Siemens AI-RAD companion is AI for MR brain sequences that has two specific applications. Number one, brain volumetry and morphometry, which is a segmentation of brain structures, volume computation, as well as comparison to age-matched normative range. And the application number two is white matter hyperdensity or MS lesion detection and segmentation, as well as volume calculation. In our case, we can see that our patient John has temporal lobe volume loss that is greater than the expected compared to age-matched. Okay, so now let's get to most important part of what we do, which is dictating our findings. It's a lot of information to report that we just went over. Typing in numeric results within AI findings is a tedious job for radiologists. But here, as you can see on the left TV, the values are automatically sent to Nuance PowerScribeOne, which then populates the appropriate fields in the report. Because the AI results are coded in the RadLex lexicon and other coding systems, the AI results are easily and automatically populated into the report template. Please note that for the purposes of our demo, this is only an abbreviated version of the report. Again, I want to emphasize that none of the values or the observations that you see within the report were actually dictated by the radiologist. They were all auto-populated. Now, as an aside, you may have noticed that all of these different applications that I'm talking about opened correctly to the correct patient as well as the correct study. This is possible using FHIR context sensitivity. FHIR is a standard that synchronizes clinical applications such as the EHR, PACS, reporting systems, and the various AI tools that I've mentioned here today to a particular patient and specific study. It enables different applications to look at the same patient securely. Under the hood, Visage has shared the AI results with both Nuance PowerScribeOne and Epic Radiant via FHIR. The upcoming versions of FHIR will also facilitate the exchange of measurements and AI findings, and you are getting a sneak preview of that here today. Sharing the data like AI results and/or measurements enables another exciting development in standards: the exchange of real-time data for convenient embedding into the radiology report via IHE integration reporting applications. So returning back to our patient, the report is now sent to Laurel Bridge AI Workflow Suite, where it can then be distributed to the EHR and other systems. Products like Laurel Bridge are yet another unsung hero of healthcare integrations, enabling seamless exchange of data with on-the-fly translation between formats including DICOM, HL7, and FHIR to ensure that all systems can communicate effectively and make everything work just right. In our example scenario, the Laurel Bridge Compass Workflow Manager served as the AI orchestrator by connecting modalities, PACS, 3 different AI models, AI viewers, and an AI registry and reporting system. As we saw earlier, Laurel Bridge AI Workflow Suite also converted DICOM SR results into HL7 so that the data is understood in both the PACS and EMR. Additionally, it was able to normalize series descriptions so that various AI systems could consistently display or process the related images. Thanks to this interoperability, the radiologist is able to plug in the results within seconds and finish dictating the remainder of the study. So back to our MRI. Remember how our radiologists reported findings that were concerning for both ARIA-E and ARIA-H? These findings are suggestive of a possible adverse event or drug toxicity to the lecanemab that the patient was taking. Now, it is now our responsibility to notify the ordering neurologist so that they can change the medication or change management, such as discontinuing the next lecanemab infusion. Now, I encourage all of you to think back on your practice. How many times have recommendations within the radiology report been brought to the attention of the ordering provider with timely action? Wouldn't it be helpful if the content in our radiology reports could translate to downstream, immediate clinical action, like communicating the presence of changes and drug toxicity? So that brings us to CDS hooks, which can help bridge our imaging report and the electronic medical record. Briefly, CDS hooks is an HL7 specification for clinical decision support that leverages RESTful APIs and interaction to integrate CDS clients, like the electronic medical record, and CDS services to provide clinical support. Hooks, like opening the patient's chart in the EMR, trigger a CDS call to the CDS service to provide feedback for the triggering event. Information or suggestions are returned to the clinical user based on the triggering event. Now, let's see how this works with our example. We here can see an Epic patient summary window. Here we can see an AI-generated comprehensive medical history as well as current symptoms. There's a generative AI solution that works behind the scenes to extract relevant information from our patient's charts. We see that this patient interface displays our patient's presenting symptoms, history of Alzheimer's disease diagnosed at the memory clinic, history of taking lecanemab, and more details about prior workup, including a baseline MRI. The radiologist reviews these findings and hits the sign button next to exit the workflow. The EPIC integration demonstrates the value of CDS hooks to communicate actionable information from the radiology report to the ordering provider. The ordering doctor logs into their computer before rounds and notices an alert in their inbox. The message contains an update that John's MRI report was finalized and a link that takes them to the patient's chart where they can see an hour practice advisory. Upon entering the chart, Adam's doctor triggers the CDS hooks workflow, and a CDS card is returned, which you can see here. Thanks to CDS hooks, the neurologist discontinues the next infusion, preventing a lapse or delay in appropriate, timely action. Now going back to John, remember the patient presented with altered mental status? Going back to that presentation, after we obtained the MRI and diagnosed ARIA-H, John unfortunately experienced a cardiac arrest and was admitted to the ICU for further monitoring. Several support devices, including endotracheal and enteric tubes, were placed by his care team, and a chest radiograph was obtained to confirm the positioning of these support devices. Note that the radiologist uses EPIC Radiant interface to review the imaging workflow. Here we can see a column titled Reading Priority. If we hover over that marker, we see a pop-up indicating the AI reading priority. This prioritization was bumped up due to a potentially emergent finding being flagged by the algorithm, which is sent as a worklist prioritization HL7 message to EPIC by Laurel Bridge and Qvera. In this case, a misplaced ET tube that needs our attention sooner than later. Note that the study is reprioritized to the top of the list based on that score to make sure that the radiologist sees the study as soon as possible. The images are then sent to Laurel Bridge, which routes the images to Visage packs for storage and the Siemens Healthineers AI RAD companion chest X-ray algorithm for line and tube detection, as well as Fovea AI cockpit viewer that we saw earlier. So, the Siemens Healthineers AI RAD companion chest X-ray tool is a solution currently cleared for use in Europe and can detect pneumothoraces, pleural effusions, consolidations, atelectasis, pulmonary lesions, as well as misplaced endotracheal tubes. In our case, we will see that it places a bounding box around the tip of the tube and provides a measurement of the distance above the carina. We can also, as the radiologist, adjust the calipers if needed if we had, for example, disagreed with this finding. In our case, we see that the ET terminates near the carina. Laurel Bridge then sends the confirmed findings to the packs and other appropriate locations for storage. Now, unfortunately for John, while he was in the ICU, John's physical exam was significant for pain at his elbow, and traumatic injury is suspected given his history of a fall. Radiographs of his elbow are obtained and sent to Laurel Bridge AI Workflow Suite, which routes the images to Visage packs for storage, and Milvue MSK algorithm for fracture detection, as well as Fovea AI cockpit viewer. AI results from Milvue MSK are then sent and viewed in the Fovea AI cockpit viewer. And Milvue MSK is a radiological computer-assisted detection, triage, and notification software that analyzes MSK X-rays for the presence of suspected fracture. In this case, the AI results indicate concern for a fracture of the radial head and a small joint diffusion. The radiologist can then review the images and confirm that there is in fact an acute, mildly displaced intra-articular comminuted fracture of the radial head and a small joint diffusion. Fovea Cockpit allows the radiologist to view, modify, accept, or reject Siemens-created annotations, all while having the ability to view the original images in our Visage 7 packs. In our case, the radiologist agrees and accepts these findings. Results are then sent back to Laurel Bridge, our AI orchestrator, which then sends them to Visage 7 packs for archiving. So, throughout this demo, we have seen multiple different AI tools employed, and chances are that you are seeing AI deployed in your own practices as well. But what happens after we deploy the AI tools? Well, we need a way to monitor algorithms for any decline in performance or model drift due to factors such as changes in the patient demographics or imaging protocols. It would also help to compare model performance locally to nationally established benchmarks. This is where ACR's Assess AI comes into play. Assess AI is the first national registry for real-world monitoring of AI algorithms for medical imaging, providing longitudinal concordance data between the algorithm results and the radiology report. Their algorithm results and the radiology report, Assess AI is a mechanism for post-market surveillance that developers can use for algorithm improvement. It is a part of the ACR Recognized Center for Healthcare AI, or ARCH AI, which sets guidelines for AI use in imaging interpretation and ensures radiology facilities are using AI effectively as well as safely. So, what we can see here on the left screen here is an example dashboard showing a map of the United States with descriptive characteristics such as patient demographics and the incidence of the finding of interest. In this case, this is an intracranial hemorrhage algorithm for the selected geographic locations. This gives us an idea of how our site's unique practice environment compares to others where the algorithm of interest has also been deployed. Moving on to a second dashboard, which will show us concordance rates between radiologists and the AI results over time. Again, this allows for visualization of potential model drift or changes in the use of the tools, allowing us to pinpoint a specific time to analyze the factors contributing to model drift. Here, we can see 1 month's representative data. But here's what happens what we would expect if similar data was reported for the entire year. The blue dot represents national concordance, and the green star represents your facility, allowing a comparison of how AI concordance at your site compares with a national benchmark. As we can see here, it looks like our concordance at this site is dropping over time. And now it's our responsibility to figure out why there is this model drift. Well, this is where this third dashboard provides an opportunity to drill down on the specific factors related to modality, manufacturers, demographics, and other factors contributing to drift to better understand trends that may warrant further intervention. As this is part of the National Radiology Data Registry, collected data could be used in the future for quality improvement measures as well. That brings us to the end of the demo. We've covered a lot of different products and taught you a lot about what is possible with AI. We hope that you consider taking a few takeaways. The architecture of the overall system for your hospital is critical for seamless communication across systems. Requiring international standards such as DICOM, HL7 FHIR, and IHE profiles will enable interoperability. Requiring structured, coded semantic systems such as RadLynx, LOINX, SNOMED will make the AI and other data interoperable throughout your system, and you must ask for the use of these standards in every RFP for every system. Thank you, and please look forward to the other two demonstrations.